Good afternoon, everyone, and welcome to the combined PCMCH and Born Ontario presentation that's dealing with live birth registration in Ontario. This webinar was originally done on May 7th, I think, and at that time, Marilyn Booth and Deshane Fell from Born Ontario and the Provincial Council co-presented this information. Today, my name is Anne Sprague, and I'll be presenting the content part related to birth registration, and we're hoping that Marilyn will be on closer to the end to just talk about the policy issues associated with this. So we're going to go ahead and start. I don't have control of the slides. It's in another room, so I'm going to, you'll hear me asking for the slides to be advanced, and we hope that will go very well, but we'll just try that. So Val, can you give us the next slide, please? Great. So the outline of the presentation today is we're going to talk a little bit about the background information on measurement of the infant mortality rate in Ontario and Canada. We're going to talk about legal requirements related to our legislation in Ontario. We're going to talk about strategies to facilitate the completion of live birth registration and talk about a few of the problems we've discovered in Ontario related to that. And then, as I mentioned, Marilyn will come on board and talk a little bit more about the actual policy implications for those of you who work within hospitals. Next slide, please. So to begin with, I'd like to take a moment to define birth registration and provide some perspective on its importance and its purposes. As you can see on the slide here, it is birth registration is enshrined as a human right according to the United Nations Convention on the Rights of the Child. And in Article 7, this convention advocates that every child be registered immediately after birth. And you can imagine why this is so important, but as we go through the presentation, this becomes a little bit more clear. Next slide, please. On a more pragmatic level, what are some of the purposes of birth registration that you see here? And so at the individual level, there's certain administrative and legal purposes, such as establishing proof of identity, for the ability to get a passport, eligibility for social benefits, such as Medicare. At the societal level, it's more about demographic purposes, for instance, calculating population projections, and routinely used in epidemiology for measuring population health indicators such as fertility and mortality, and establishing priorities for health services. And finally, internationally, vital statistics data that are assembled from birth registrations and other vital event registrations are often used for health comparisons. For instance, they can be used to measure a country's progress and commitment for fighting specific diseases. An example of that would be the United Nations MDG, or Millennium Development Goals, and we'll return to this in a moment. Next slide, please. So with the introduction of this, I'd like to take a few minutes to talk about measurement of infant mortality in general, and then specific to the Ontario and Canadian context. Next slide. So first is the simple definition of infant mortality, and it's defined as the death of an infant during the first year following birth. It's an extremely important population health indicator and is often proclaimed as the most comprehensive indicator of the level of health in society, since it provides an important measure of well-being of infants and children, as well as the quality of health care in a particular country. And because it's such an important indicator, it is mentioned a lot as a worldwide indicator of population health. Next slide, please. At the United Nations, so again, that MDG stands for Millennium Development Goal, and number 4 related specifically to infant mortality. And because it's such an important population health indicator, they put it down as goal number 4. And the UN and other agencies routinely assemble and compare information on this important health statistic across many, many nations. Next slide, please. So what you see in this graph is from the Organization for Economic Cooperation and Development, and they look at the ranks and, they assemble these across nations, including things like infant mortality. So in this slide, using data from 2006, you'll see a ranking of 33 nations. The country with the lowest infant mortality rate is shown on the far left, around 1 per 1,000, and at the far right is Brazil at about 25 per 1,000. And normally we think that Canada is a pretty good country and that we do quite well in health indicators. But you can see here that we're ranked 24 out of 33 of these countries based on an infant mortality rate of about 5 per thousand. Next slide, please. So Statistics Canada is another group that will often report on infant mortality rates. And this is from our own Stats Canada data for their annual publication on deaths. And this particular report is from 2006. And here again, they're ranking several nations and have ranked Canada as 13 out of 15 nations with a rate that's about twice as high as the lowest ranking country. Next slide, please. And so here I also want to note on this Statistics Canada website data that you can find is that annual infant mortality rates are available through this interactive StatsCan website. Data tables exist here from 1974 to the most recent available year, which is 2008, and nationally, and then also by province and territory, including for Ontario. Next slide. And this particular table shows the infant mortality rate for Canada and for the province of Ontario from 2004 to 2008. And you can see that for the example, the IMR per 1,000 live births was 5.3 in Ontario in 2008, very similar to that national rate of 5.1 that we saw earlier. Next slide, please. Now, to calculate infant mortality rates, it's a matter of having the right numerator and the right denominator. And in this particular calculation, you can see it's the number of deaths of infants under a year of age per 1,000 live births, and of course, in a given place and time is the way that it's defined. Next slide, please. And so now what you actually see is the calculation, and it's expressed as a formula showing how the numerator is the count of the number of infant deaths, and the denominator is the count of number of live births. It's then multiplied by 1,000 to give us the rate per 1,000. Next slide, please. Now, obviously, this seems very, very simple. However, as you'll see in the next few minutes, it's actually quite a complex indicator, and one that's increasingly complex given regional variations in consistent birth registration practices, as well as variations over time, which are also known as temporal variations. This variability particularly affects babies that are born very preterm or at a very low birth weight. Next slide, please. So without going into great detail, I'll just acknowledge that there are a number of different methods in the way that the infant mortality rate formula I've just shown you is actually computed. For instance, you'll frequently see period IMR or cohort IMR, and these primarily refer to differences in the way that the numerator or number of infant deaths is assembled for a given birth cohort. The IMRs that we've examined to date in this presentation have all been crude period calculations. Two other variations of the IMR are gestational age-specific IMR and birth weight-specific IMR, and these are the real key ones that most of us who are sitting in hospitals, health units, midwifery practices, at the population level, these are the ones that we're probably most interested in. And these are really considered the gold standard of IMR calculations, and these are the ones that we have problems with in Ontario. So first, gestational age and birth weight are among the strongest predictors of infant mortality. You all know that babies that are born very preterm or very low birth weight have a much higher probability of dying compared to other babies. For example, in the last Canadian Perinatal Health Report, it was reported that in the time period between 2001 and 2003, there were 681, can you go back there, Val? Sorry. 681 live births registered in Canada. It excluded Ontario, though, and we'll continue to talk about this in a minute. And these that had a birth weight of less than 500 grams. And of these, 681, of the 681, 638 of those babies died, corresponding to a rate of 94%. So obviously, the smaller and the earlier you're born, the more likely you are to have problems. And secondly, related to this, there's a great deal of variability in complete and consistent registration of live births that are very preterm or very low birth weight. And that's really the crux of what we're going to talk about today. Even within Canada, there's variability about this, but it's particularly true internationally, which very much compromises our ability to look at the international rankings based on IMRs. And we'll talk more about this. Therefore, gestational age and birth weight-specific IMRs are essential for meaningful and valid comparisons across time and countries, and even within Canada. Next slide, please. I'm now going to talk a little bit about the data sources that are required to compute IMRs, and this is really important related to what happens with parents, with babies, and babies who die shortly after birth. So first of all, we need a source of information on the infant deaths for the numerator of the rate of calculation, and this is obtained from Vital Statistics infant death registration. So in Vital Statistics in all the provinces, they get the data on every death that occurs. Secondly, you have to know the number of live births for the denominator, and that usually comes from, again, Vital Stats from their birth registration files. So live birth registrations and infant death registrations are completely separate Vital Statistics files, and therefore, in order for us to be able to do something with these things, the best way is to link those files. So they can be used separately, which are the unlinked files, and sometimes the infant deaths are linked back to their births to create something known as a linked file, and that linked file is very, very important. So let's go on and talk a little bit more about that in the next slide. So the purpose of the linked file you can see here, it's really the cornerstone of national and international perinatal surveillance. These linkages are done on an annual basis in both the United States and Canada by statistics groups, and in Canada, it's Statistics Canada. And the purpose for linking these two registration files is that the infant death registration contains limited information related to birth. So when someone dies, and the further out from birth you are, it can be hard to know some of that very important birth information that could therefore probably impact on why that baby died. So the purpose, again, of linking the two files is that the infant death registration then is tied back to the birth. For instance, this slide shows some of the variables from both registration types, and you'll see that there's some duplicate information, such as date of birth and infant sex. However, the birth weight and gestational age at birth are on the birth registration, but they're not on the infant death registration. So even when the death occurs mere moments after birth, that information isn't there. So the real value of a linked file is that it allows calculation of gestational age and birth weight specific infant mortality rates, which we already discussed are essential to the most valid calculations of infant mortality, particularly when the purpose is to make comparisons across time, provinces, or countries. Next slide, please. So here's an example from Canada, from the Canadian Perinatal Surveillance System's Canadian Perinatal Health Report. The top line in this figure, indicated by the arrow, presents the period infant mortality rate calculation. And this is all the infant death and live birth registrations, even those that correspond to infants born at extremely low birth weights, for example, below 500 grams, or at very low gestational ages. So that rate of 5.3 per thousand, this is 2003. And you can see that. Now, if you'd flip to the next slide, the next slide now shows us the same rate after excluding infants who had a birth weight of less than 500 grams from the numerator and denominator. And this calculation used the link file in order to be able to make this exclusion based on the birth weight. So in 2003, the rate of infant death per 1,000 live births for babies over the 500 grams was 3.7 in Canada, excluding Ontario. So the rate changed from 5.3 to 3.7 by excluding just the tiniest babies born at the borderline of viability. Next slide, please. So now, when we look at that international ranking, you can see it makes an enormous difference when making international comparisons. For instance, in this recent paper published in the British Medical Journal, the authors looked at 18 countries, including Canada, but excluding Ontario, and we're going to come back to this again, to compare the rates and rankings based on a crude IMR, which is what is routinely used by the United Nations, the OECD, Stats Canada, and other organizations for this type of exercise, and then based on birth weight specific IMR calculation for where the live births under 1,000 grams were excluded. On the left panel, you can see that using that crude IMR, Canada had a rate of 5.05 infant deaths per 1,000 live births and ranked 12 out of 18. The right panel shows the rates and rankings after excluding births under 1,000 grams. Here the rate for Canada was 2.49 per 1,000, and the rank was 6 out of 18. So again, we've mentioned excluding Ontario, and if you think about it, Ontario is 40% of the births in Canada, almost 40%. So would it make a difference? Maybe a little bit, I'm not sure. Anyway, why is there such a large difference between these two? Because Canada's birth registration guidelines require that all live births be registered regardless of their gestational age or likelihood of survival. However, in many other countries, they only register babies after certain gestational ages, for example, after 22 weeks or over 500 grams based on the likelihood of survival. The result is that countries such as Canada and the U.S. come out looking much worse in crude international rankings since the smallest babies are registered. Next slide, please. So we've talked several times in this presentation about Ontario being excluded from the Canadian IMR calculation for certain reports. And a number of years ago, through their work with the National Linked Live Birth Infant Death File, the Canadian Perinatal Surveillance System, which is out of the Public Health Agency of Canada, noted that in Ontario, a high proportion of infants who die within their first year of life, and particularly those who die early in the neonatal period, don't have their birth registered. This means that in the linked file we described, a large number of infant deaths in the province of Ontario can't be linked back to their corresponding birth registration in order to make use of birth weight and gestational age specific IMR calculations. For reasons that we don't quite understand, this does not happen in any other province or territory in Canada. Because of this under-registration of these vulnerable babies, Ontario is consistently left out of important CPSS reports for those indicators that are based on vital statistics data. This is because not only does the exclusion of these live births preclude the calculation of birth weight and gestational age-specific mortality rates, it also affects the accuracy of calculations of other important indicators such as rate of low birth weight, rate of preterm birth, rate of multiple birth, if they're based on vital stats live birth registrations. So as I've mentioned, given that Ontario is the province in Canada with the largest number of births, about 40%, excluding Ontario from national perinatal indicator calculations is a huge limitation and concern, and something that BORN has been working on in a number of different ways. Next slide, please. So this is the proportion of unlinked infant deaths, and this is kind of a startling graph. So this is based on the most recently available National Linked Live Birth Infant Death Registration File at CPSS within the Public Health Agency. In the taller, darkly shaded bars is the percentage of infant deaths that cannot be linked to a birth registration in Ontario. And in the small light blue bars is the rest of the Canadian provinces and territories. So as you can see, the proportion of unlinked deaths in Ontario is many times higher than for the rest of Canada. For instance, in 2005, the most recent linked file that is available is 42.7% of infant death registrations that couldn't be linked to their corresponding birth registration. This corresponds to 321 out of 751 infant deaths in Ontario. In contrast, in the entire rest of the country, only 8 out of 1,093 infant deaths could not be linked. The reason behind this problem is not well understood, and we'll come back to this in a few minutes. So next slide, please. So now we're going to review the legal requirements for live birth registration in Ontario. Next slide, please. So live birth registration is a legal requirement in each Canadian province and territory, and there's a Vital Statistics Act in every province, basically. But as you can see here, a live birth is defined by Vital Stats as the complete expulsion or extraction from its mother of a product of conception, irrespective of the duration of pregnancy, which after such separation, there's any sign of life, is basically what it says, that there's breathing or beating of the heart, pulsation of the cord, or definite movement of voluntary muscles, whether or not the umbilical cord has been cut or the placenta is attached. So that's the definition. And in other words, this includes even those infants who die within the first few minutes, hours, or days following birth, regardless of their gestational age or birth weight. Thus, if at any time of delivery there are signs of life, even for an extremely small preterm baby, and the baby dies within a few minutes, this should prompt both a live birth registration and a death registration. So any time a death registration is completed for an infant, their live birth must also be registered. Now, I know this can be hugely contentious in some areas, and I know there's been a number of discussions in hospitals around the years about this definition and about the legislation. But this is the law, and this is what we are required to do. Next slide, please. So the question becomes, how do we go about registering live births in Ontario? And many of you who work in hospitals certainly know this because you're part of this process every day. Similar to most other Canadian provinces and territories, there are 2 forms required to complete a live birth registration in Ontario. One that originates from the primary care provider who delivered the baby, the physician or midwife, and another one from the parents. Next slide, please. So this diagram shows the flow of information required to complete a live birth registration in Ontario. As mentioned, the notice of live birth, shown in the upper left-hand corner, must be received from the primary care provider or hospital, and the statement of live birth, shown on the upper right, must be received from the parents. Once the Office of the Registrar General within Service Ontario receives these 2 notices, the event is officially registered and the information is compiled into an annual provincial live birth file. And this file is then the one that's transferred to Statistics Canada for addition to the National Vital Statistics files, including the linked file. Next slide, please. Insofar as we understand, we think that the incomplete live birth registrations in Ontario mainly arise as follows. The notice of live birth is received from the primary care provider, but the parental statement of live birth is not received by Service Ontario. The event, thus, is never officially registered, and the record does not get included in the provincial or ultimately the National Vital Statistics files for the year. So the next slide, we're going to deal with why this happens. So why it happens in Ontario but not so much in the other provinces is not well understood, but the Canadian Perinatal Surveillance System recently did some investigation and noted that a majority of the missing live birth registrations for infant deaths in Ontario were those who died in the hospital, deaths occurring in the neonatal period, and infant deaths from causes that are specific to the perinatal period, such as short gestations, respiratory distress, low birth weight, hypoxia, etc. This suggests that most of these deaths occur following complicated pregnancies and births. Next slide. So as part of the process that Bourne was working on, we've taken all this data, we put it together, we looked at it, we completed a report, and we did a small survey with our regional coordinators, went out and asked hospitals what their practices were about helping parents register births. So we did 77 hospitals, and we asked them about their policies and practices regarding live birth registration of healthy babies and the babies who die in the hours or day after birth. And some hospitals, we found, provide specific support through live birth registration to parents who have experienced a neonatal death, but many do not. For instance, 33% of the hospitals that responded said they didn't have a specific process for assisting parents with neonatal death through live birth registration, and this percentage is higher for level 3 hospitals, where the number of infant deaths is likely highest. We also asked whether there was a process in place to ensure that all babies were registered prior to maternal discharge, and that happens in other provinces. But only 6% of the responders reported that live birth registration was completed in hospital prior to discharge for all babies. Next slide, please. I think this is probably very telling. A number of comments that we got received from care providers and hospital included the fact that they felt that grieving parents may not know their requirement to register the live birth in addition to the death when their baby dies shortly after birth. And some care providers, understandably, also mentioned that the tremendous challenges associated with approaching bereaved parents to ensure they complete the documentation for live birth registration, and felt it was somewhat insensitive. And so you can understand how that would happen. However, there's paperwork that goes along with all of this that does need to be completed. And so we wanted to find out, what maybe some of those barriers were, and down the road, we need to know what the enablers would be to ensure that this gets corrected. Next slide, please. So finally, we'd like to spend the remainder of this call discussing some strategies to try and improve the completion of live birth registration, regardless of birth outcome. Though our primary interest is really in improving the registration completeness for infants who die in the minutes, hours, or days following birth. Remember, this is not stillbirth. That's a whole other set of paperwork, and this is related to babies who are born, who have any of those signs of life, and who die shortly thereafter. Next slide, please. So the first thing we'd like to say is that in the past several years, Service Ontario has made major changes to the birth registration process in order to make it easier for parents to register a birth. This includes a new online system as well as the elimination of municipal birth registration fees. So you can imagine that years ago when there was a fee on top of everything to register a baby that had died, that would just be like adding insult to injury. But anyway, that has all been changed. However, as we saw earlier, the most recent national live birth infant death linked file available at the present time is 2005. Thus, it will still be several years before the files pertaining to the time period after these system changes were made are linked. And we know whether these changes will have an effect on the incomplete registration for babies who die. Next slide, please. Another potential short-term solution is to try and resolve this important problem. Is the reason why we're having this today, is that Born Ontario and the Provincial Council for Maternal Child Health are collaborating in order to recommend that hospitals consider potentially making some changes to birth registration practices in hospital. And this very much follows the example set by several other Canadian jurisdictions. For example, in Alberta, there is a province-wide policy to ensure that the live birth is registered in the hospital when a neonatal death occurs. In addition, Alberta also has a province-wide policy that all babies have their live birth registered in the hospital prior to discharge of the mother. Now, obviously, not every baby is born in a hospital in Ontario, and some of this relates to midwifery and midwifery home births. But again, the midwives also have the need to complete this paperwork. So whatever we're talking about also applies to that group, although most of the deaths will occur in a hospital. So what are some other potential solutions? Next slide, please. In the long term, it's important to evaluate whether the birth registration system changes implemented by Service Ontario in combination with this policy regarding in-hospital birth registration have an effect on reducing the number of unlinked infant deaths in Ontario. However, as I mentioned, the linkage of live birth and infant death registration files typically occurs several years behind real time. So for the moment, we need to wait for data to accrue in order to do this evaluation. And we're also working with the Ministry of Health and Service Ontario to see if there's anything we can do related to the process. However, if there are still problems with the unlinked infant deaths even after these two strategies have been implemented, the next step would be to see, as I mentioned, if there's further system changes and more complex strategies that need to be done. Next slide, please. Marilyn Booth of PCMCH, if she's on the line, I hope, is now going to...
Yes, Ben, can you hear me?
Yeah, I can. Is now going to briefly review the recommended birth registration policy template for organizations. So, Marilyn, go ahead, please.
Thanks, Ann. So PCMCH and Born Ontario work together to do a template, which will be available on both of our websites. And next slide, thanks. The proposed policy template is intended to really help hospitals with putting a policy in place to facilitate live birth registration of those infants that die before the parent is discharged from hospital. I would note that this doesn't include acquisition of a birth certificate or any other related legal documents. Next slide, thanks. So our request, the next slide, thanks. Our request to you is that each Ontario hospital that provides birthing services put in place, as part of your approach to supporting bereaved parents of newborns, a policy and an accompanying mechanism to help those parents with completion of the second portion of the live birth registration process prior to maternal discharge from hospital. And I think having the policy template and the discussion about how you can adapt that to your local needs and who will be providing the services will give an opportunity for discussion about, who is currently supporting bereaved parents and how can they build this into the work that they're doing. Next slide. Thanks. So what can you do? First of all, ensure that all care providers and staff who support bereaved parents understand that live birth registration is a legal requirement, even for babies who die within a short period after birth. If they meet that criteria of live birth, then the birth must be registered. And as soon as possible, help these parents who experience an early neonatal death with registration. Next slide, thanks. So the birth registration policy template, as I say, is going to be available both on the PCMCH and the Born websites for your ability to access it and customize it for your organization. And, if you can host a staff in-service to ensure that staff who are working with bereaved parents understand the process requirements and processes. The slides that we've used today are also going to be available on both websites. And a question and answer document that answered questions from the first webinar is available, and it will be updated after today and will be again on both websites. And last but not least, be sure to contact your Born Ontario Regional Coordinator to help with any strategies regarding implementation. So, Anne, I'm going to hand it back to you.
Okay. So, we understand that every hospital in the province is unique, that you all have different processes out there for, dealing with bereaved parents, and, that this is, can be an incredibly difficult thing to do, but I think in order to improve our ability to look at health indicators in Ontario, it is important that we think about going down this road to improve the registration of infant death. So we can now open this up to questions. I can tell you that the question and answer from the last webinar are on the Born website, and I think they've been placed on the PCMCH website already. So there's lots of Q&As that came up last time. If somebody wants to ask questions this time, we have a chat bar that is on your screen if you're logged into the system. And we can answer questions that way by reading those. We can also answer questions if you want to ask a live question on the phone. You press 01 to get into the queue. And Valerie or Britton, I'm not sure which one, will actually announce your first three digits of your phone numbers, and we'll open the line for you to ask your question. If you hear that a question you were going to ask has already been answered, you can press 02 to get out of the queue. So I'm going to scroll up here now to the top. This is sometimes difficult.
And there's quite a buzz in the line. I don't know if there's anything. Oh, yeah.
Okay, I'm going to go back to a headset just a second. Is that better?
Yes, actually, it stopped it.
Okay. So the first question on the website here is there's a question here about surrogate births. When we have a surrogate birth, who is responsible for filling out the live birth documentation? Is it the birthing mother or the intended parents? And this was asked last time, and in fact, it's question number 12, I believe, in the form that we put on the website. But just to let you know, we did go back to Service Ontario to find that out. The birth mother must register the birth. In this case, the other parent section of the form is left blank. An application can be... Sorry, there's an announcement here. Just a second.
Code white emergency, emergent care.
Sorry, it's the joy of being in a hospital, right? So either the surrogate can apply for an amendment afterwards, or if the intended parents, if they're considered the legal parents, can apply. So that question is in the Q&A, and there's a well-documented answer about that. So you can go on to the system and read that. Okay. Sorry, I'm not very good at scrolling up through these things. A lot of questions.
There's a question about whether other parents or other provinces also require parents of a sad loss like this to have to fill in a statement of live birth.
Yes, almost every province in Canada does their birth registration the same way. There's another question here. It says, where can we find this presentation? It is on the Born Ontario website and the PCMCH website. And we can, I'm not sure exactly what section it's in, but we'll find it and find that out. There's a question here that says, how do we show that the infant is deceased on the form when it is entered on the computer? We used to state on the top of the form deceased, so it alerted the appropriate people. Okay, hang on just a sec.
So there's actually two forms. So once the baby is born, the attendant fills out the Form 1, the Notice of Live Birth. The parents fill out the Statement of Live Birth, and if the baby has died moments after, you actually do have to fill out a death registration. So you can't just indicate on the form that the baby has died.
Thank you. Another question here. It says, we are concerned about the ability to enter the accurate birth weight less than 500 grams as the system does not allow our lower birth weight to be entered. How can we help change this? That's a really good question. We will check with Service Ontario about that, and we will include it on the Q&A form, and we'll amend that on our website. Thank you. The next question is, would it be possible to have feedback to hospitals of missing birth registrations? We can't do that because they don't come through Born or PCMCH, but we could let us look into that and see if there's a way to do it. Is there any questions on the line, Valerie?
No, not right now.
Okay, so the next web question, sorry, this thing moves every time a new question comes on. I want to ask, was discontinuing the parent form and putting the crucial information on the hospital's form so the grieving parents are not included in your data collection form? That's certainly an option that could be explored. Anytime, of course, you have to change legislation or process, it's a pretty long process, but certainly one that we can explore as well. There's a question that says, what about parents who may deliver prematurely in the ER, in the emergency room, i.e. a 19-weeker that may have some gross motor movement gaps? I suspect that these may get missed. And it's true, those babies may get missed. I would think that within hospitals, if you're doing in-service to your departments, you might also want to include, a manager or an educator or somebody from the emergency room to let them know what the legislation is. There's another comment that says it would make more sense if the parent just had to fill out a statement of death box to check if the baby was born alive. So again, another similar comment. And again, that's a process within the Vital Statistics Act. So it would take a lot of things to change, but certainly something we can bring that forward. There's a question, can death registration be online? That I don't know. We'll find that out for you and get back to you and put that. Britain has given us the documents on the Born website, so if you are looking for those on the Born website, you go to bornontario.ca. They're in the news section, and it's under the Born Ontario briefing is where you'll find the documents. There's a question here, in the IMR calculations, do they include termination of pregnancies where the infant is alive, birth, and dies shortly after birth? That's a really good question, and I know that's one that often people ask about. If it is meant to be a termination of pregnancy, I would think, and let me say that we need to go back and verify this, but certainly if you are terminating a pregnancy, it probably shouldn't be registered as a birth. But we will validate that for you. It says, at Blue Water, we do not register stillbirths online. We send the form to City Hall. Has this practice changed as there is a box to tick stating this child was born alive? Now, we didn't do the work for this presentation on stillbirths, but again, if that's a question, we can certainly find out the answer. Stillbirth is a completely different form.
Yes, and I think there's something about that on one of the Q&As.
Okay, there's another person who just said, what, no registration for terminations? That's a no birth registration. And again, I will go back and validate that exact question for you. But there is, I mean, we keep track of terminations within your various databases and whatnot in the hospitals. But whether or not that should be registered as a live birth if the baby's born alive is the question that we would need to sort out. Somebody says, getting back to the terminations, when they are born alive, we do register them online, but they are not identified as a termination of pregnancy. So again, another thing that we have to sort out about terminations. So we will definitely find the answers to that and get back to you. Are there any questions online, Val?
No, there's no questions in the queue.
Okay, and there's no other questions here on the web chat. So I'm hoping that we provided you with some information that you will be able to use within your hospitals. Ideally, getting birth registered prior to parents leaving the hospital would be wonderful, but for all babies, but critically important to get those babies who die shortly after birth registered. One of the big questions that came up in the last session that I can bring up is that people wondered, it asks for a name on the form and felt that sometimes was a holdup in terms of getting registered for birth for infant death. And so Service Ontario has told us that in the case of an early neonatal death, they would accept on the form, if the last name was Smith, Smith baby girl, as opposed to Smith Sue Ellen or whatever the name was going to be. So if the parents have not yet named the baby and they intend to do that, they can file for an amendment after the initial paperwork is done. Of course, there's a fee for that, but to get a birth registered, they can use, in the case of a death, they can use baby girl or baby boy. Another question about terminations. Some terminations occur late for lethal abnormalities, i.e. 27 weeks for lethal cardiac. They would definitely be registered as a birth. Termination doesn't always mean that at 20 weeks or less, and you're absolutely right, and that's a good point. So, again, the need to help you folks by getting that clarified is important, and we will get that information for you. So if there are no other questions, I think it's 12:45. We've had a good 45-minute session. Again, probably is, although it says Deshane fell, I'm Ann Sprague. Deshane, for those of you who know Deshane, successfully completed her PhD comprehensive exams yesterday and is taking a well-deserved weekend off. So I stepped in to do the presentation for her today. And so if you have questions, you can just send them to info@bournontario.ca, and we will make we'll make sure that those questions get answered. Or if they're sent to Marilyn Booth or PCMCH, we work together and we'll get those documents updated and on the web for you. Any other closing thoughts, Marilyn?
No, other than my email address should be marilyn.booth@pcmch.on.ca.
Okay.
But thanks, Ann.
Thank you, everyone, and we hope you'll work with us to make these important changes so that we can start to have better reporting of Ontario outcomes, both in Ontario, nationally, and internationally. Thank you.
Thanks, Ann.